The reason we did this study is because we clinically observed that some individuals carrying the MITF E318K variant had multiple melanomas, while others did not. We wondered if other genetic variants could be contributing to the risk. An obvious candidate was MC1R, common red hair color variants, because they're known to increase melanoma risk, and they also increase and moderate melanoma risk in CDKN2A carriers. In terms of how we did this study, the E318K variant is relatively rare, affecting about 1 in 200 individuals in the general population. Therefore, we had to collaborate widely in order to evaluate this interaction. We collated genotype and infection status data from E318K positive individuals from Spain, Germany, and multiple Australian studies. We also used reference databases which contained affected and unaffected E318K carriers. There are two types of common red hair color variants known as big R and small r, associated with a 2-fold and 1.5-fold increase in melanoma risk, respectively. For E318K carriers who had a big R variant, they had an increased risk as expected for melanoma. But we found that those who carried the small r variant didn't have an increased risk. In fact, the people who carried the small r variant had a comparable risk to those who didn't carry any of the red hair color variants. So this is really valuable because firstly, when we're looking at patients in front of us, it allows us a greater understanding of their individual risk, which then empowers dermatologists to personalize their management. Secondly, we know that melanoma screening in the general population is not currently economically viable. However, targeted screening for individuals at higher risk allows for effective use of healthcare resources and earlier detection. Using genetic testing, genes such as MITF and MC1R could aid in the identification and targeted screening of those at increased risk.